Right, as part of the SLP scope of practice, you'll be performing listening checks on hearing aids. A complete listening check consists of audiologist choice spray, cleaning spray, a listening stethoscope, a brush and wax pick brush, battery tester, ear mold blower, and of course, infection control. To do your check, this is a behind the ear device, you will start off by looking at the hearing aid with your eyes. You're looking for rips in the tubing, blockages in the ear mold, any loose pieces, dust in the microphone, anything that would impede the sound from getting to the ear. Then I want to listen with my ears. Put these in my ears, and I'll put the cup of the listening stethoscope on the ear mold, and I want to turn on the hearing aid. And I want to say the Ling sound test. Remember, the Ling sounds go across all the frequencies. Ah, E, U, S, Sh, Ah, E, U, S, Sh, Ah, E, U, S, Sh, Yeah, that sounds okay. So you're listening for distortion, like a broken speaker sound, and that sounds good. And while I'm talking, I'm also doing something with my hands. I'm squeezing the hearing aid because sometimes there's dysfunction within the case, and from squeezing the hearing aid you might hear some distortion. And I'm also manipulating the controls. Maybe I'm turning it on and off, I'm adjusting the volume or adjusting the program, because sometimes the dysfunction is within the controls. If that sounds good, then you're done. However, if you find a problem, there's certain things you can troubleshoot. One, you can check the battery. Opening the battery door, you can take the battery out. Your battery tester, this is a size 13. You know that because you've learned all the battery sizes. Stick it in. Maybe that's why my hearing aid's not working. It shows replace. Actually, 50% of all hearing aid dysfunction has to do with poor batteries. So then you would replace the battery. Here's a new one. When you put the battery back in the hearing aid, you don't want to put it directly in the hearing aid. You'll never get it out. You want to put the battery in the door. You want to match the positive of the battery to the positive marker on the door. Some of you will not have a positive marker, but if you look at the battery door, you'll see a ridge, and there's also a ridge on the battery. You match the ridge to the ridge. If the door does not close, you have it in wrong. The next thing you can do with your brush, you can clean the controls. Sometimes using some of this cleaner will help. Never spray this directly on the hearing aid, but rather spray it on like a tissue, and then use it to wipe the hearing aid. Dust can also collect here by the microphone. Use the brush to dislodge any dirt. Another area are the battery contacts. You want to make sure that there's no rust or white debris. White debris indicates maybe the battery has leaked. You can use the brush to dislodge any rust or debris. Sometimes there's blockages within the ear mold board. That's the hole going into the ear mold. You can take your wax pick and gently dislodge any cerumen or skin, any debris like that. You may choose to use gloves, or you may just be extra cautious, where you're washing your hands before and after. Sometimes moisture will accumulate in the tubing. You can dislodge the ear hook from the tubing. Use your ear mold blower, put it in the tubing and squeeze. Pull it apart and release. Never release when it's in the tubing because it'll just suck all the moisture back through. Squeeze, release. Squeeze, release. Now I'm going to repeat my check. It works!
Hooray!
Hooray! Thank you, Joe, for telling me this.
DJ Miller, ah, ee, ooh,
What's a link?